Never do this if you have high blood pressure. In this video, I've listed 9 extremely common mistakes that people with hypertension make in the morning, which can directly harm your treatment and put your health at risk. So it's really important that you don't make any of these mistakes. And chances are you're making one or more of them because they're very common. So let's start by talking about what people with high blood pressure shouldn't do in the morning, what they can't afford to get wrong. Number one, I'm going to start by asking you a question. If you take medication to lower your blood pressure and you check your blood pressure in the morning and it's 120/80, do you still take your blood pressure medicine as usual, or do you skip it out of fear that the medicine will lower your blood pressure too much? Why? If it's 120/80, do you think that if you take the pill, it'll drop too low? What do you think? About half of you probably answered yes, that you should take the medicine, and the other half said no. But the correct answer is that you should take your blood pressure medication as usual. Did you get it right? Why do so many people get this question wrong? Because treating high blood pressure is a continuous treatment. It doesn't depend on your blood pressure readings. So whether it's 120, 130, or 140, you need to take it as usual, just as your doctor prescribed. Why? If your blood pressure is 120/80, for example, it's because you're following the treatment. It's not just about the effect at that moment, but over days, weeks, and months. That's how blood pressure treatment works. So don't stop taking your medication. If your blood pressure is good and under control, it's because of that. I see that half of patients make this mistake, especially because a lot of them are also afraid, right? You know that if your blood pressure drops too low, you might feel dizzy, you could even faint. But in this case, it's a health issue and you need to take your medication. But if you're fainting a lot, feeling sick for several days, feeling dizzy, or like your head is empty, then you need to adjust your treatment. And that adjustment needs to be made. You should report this. Write down how many times a week you've had these symptoms and talk to your doctor. That way, your doctor can make the adjustment and you're not the one making changes on your own from one day to the next. Deal? The second morning mistake people with high blood pressure make is waking up and having tea. Because a lot of teas have substances that interact directly with blood pressure. And I'm going to list those teas here. But I want you to understand this. Teas contain chemical substances, even if they're natural, that can interfere with your treatment. Which teas are those? Which can increase the pressure? Green tea, black tea, ginger tea, mate, chimarrado. It can also raise blood pressure, but mate, for those who like mate tea, is also very common. These teas can have an effect on blood vessels and our blood pressure. So it's important that you pay attention. Conversely, some teas can lower blood pressure. Did you know that? Hibiscus tea, horsetail tea, lemongrass tea, holy grass tea, lemon balm tea. And now you might be thinking, oh, so is it good to drink these teas? And the answer is no. Imagine that your blood pressure is under control, and then one day or another you drink a tea that can lower your blood pressure. On that day, you might feel unwell because of it, because it can enhance a diuretic effect, for example. Horsetail tea contains diuretic substances, so it can interact with your treatment. My suggestion is, if you want to drink a tea, bring it to your appointment and ask your doctor, like, I'm taking these medications, will this tea interfere with any condition I have, like high blood pressure? They'll answer you and then you'll know if you can drink it safely, but I see that this is a big mistake right in the morning. And the third mistake is believing that you're fine, that your blood pressure is good, just because you don't have any symptoms, when in reality, high blood pressure is often a silent disease. You'll only start to have symptoms when there's already a complication, like, for example, damage to your kidneys, your vision, or your heart. So even if you're feeling fine, you still need to monitor and manage your blood pressure. I hear this a lot. Oh, but my blood pressure's normal. 150 over 90. I've heard this a lot because I feel fine. I don't have any symptoms. But in reality, even at that level, even if you feel fine, your blood pressure still needs to be under control. So what does it mean to have controlled blood pressure? I'll put a chart up here. Here's some data from the United States and also from Europe, because there are some differences between them. So I won't get into that debate here in the video, but I'll show you the numbers so you can see for yourself. These are the values that are considered normal, borderline, and high blood pressure. So even if you don't feel anything, you should still get treatment. And it's very common for patients with a systolic pressure of 140 or 150 not to have any symptoms at all. And often, when you start treatment, your blood pressure goes back to normal, but your body is so used to the higher numbers that when your blood pressure is at normal levels, you might feel unwell or dizzy. But this is just a temporary effect, and over time, your body will adjust to these values. Then, yes, your blood pressure will be normal, okay? This also applies to blood sugar levels. In the blood, many people have elevated levels. Then the blood sugar level will return to normal. With treatment, the person may start to feel unwell, may have symptoms of hypoglycemia, may start shaking, may feel cold sweats. So this also happens with blood pressure. It's the same logic. Just look at how the human body can, in a way, adapt to certain situations, even when they're not ideal. And number 4 is using medication without medical supervision. I want to draw attention to a particular medication here, which can affect high blood pressure. One class is the group of anti-inflammatory drugs like naproxen, nimesulide, ibuprofen, diclofenac. These medications can raise blood pressure, even making your treatment worse. And I notice that the use of these medications is very common. This is also something I see often in the clinic and in the hospital. Frequently, patients had high blood pressure and had used these medications without medical supervision. Ideally, these medications have a set period for you to use them, okay? And when it comes to these anti-inflammatory medications, for a period of 5 days or more, many studies have already shown this. They can affect blood pressure levels. Did you know that? Did you think so? That it was only after many, many years of use that it was harmful, just like some medications can have an effect. But that's not the case with these medications. Even in the short term, just 5 days, you can already have these effects on your blood pressure. And mistake number 5 is at breakfast. Since we're talking about mistakes people with high blood pressure make in the morning, one is eating a lot of sodium right away, like bacon, or processed meats, ham, fatty cheeses like provolone, parmesan, turkey breast, salami. Do you eat any of these foods first thing in the morning? That's the diet of so many people. Or olives, you have to be careful with those too, since they're high in sodium. Sauces, condiments, ultra-processed foods. Look at how many foods there are. I just mentioned a bunch here that have a load. More sodium than you need first thing in the morning. So you really have to be careful with this, with salt and sodium. Even if you don't add it to your food, you need to check how much salt and sodium you're consuming in the morning and throughout the day. What are the recommended amounts per day? For salt, it's up to 5 grams per day. And for sodium, up to 2 grams. That's 2 grams of sodium per day. It's really easy to hit that limit and even go over it. There have been many studies showing that a lot of people in the United States, Portugal, and Germany consume more than double the recommended amount, 12 grams of salt, in many countries, sometimes even more than that. Just look. The ideal intake would be 5 grams. People are consuming more than twice that amount. And if you go over that limit once in a while, it's not a problem because the body can handle it when there's an excess. If it happens for a day or two, but if you keep going like this every day with this excess, then yes, you could see your blood pressure levels get worse. Right? So I know you've probably seen some video or information saying that your body can handle salt. But actually, here I'm talking about regular daily consumption. If you eat too much salt every day, then yes, you could face consequences. And if you already have high blood pressure, and if you have hypertension, then you really need to be extra careful because it can have an even bigger impact, even in the short term. So, in the morning, watch out for those foods I mentioned. Mistake number 6 is about sleep. Did you know that sleep directly affects your blood pressure levels and can actually raise them? Because sleep is essential for producing certain substances and for relaxing your blood vessels. And how many hours of sleep per night are necessary? Between 6 and 8 hours. Studies usually point to those two numbers. I like to use the 6-hour mark because you have to adapt to real life. A lot of people work a lot or have to take care of their kids or their parents or another family member. That happens too. And not everyone is able to get enough sleep. 8 hours. How many hours do you sleep per night? I sleep 6 hours. And for me, that's enough. Less than 6 hours, even if you feel fine, studies show that's not enough, okay? Because of everything I just explained to you. There's a colleague who said he sleeps 4 hours a night and feels fine, but in the long run, that's going to have consequences. So less than 6 hours. I don't recommend that you sleep that low, and it's also important to evaluate the quality of your sleep. Let me draw your attention to something here. To a cause of hypertension, yes, that's right, this can cause high blood pressure, which is obstructive sleep apnea. During sleep, your oxygen flow gets interrupted. Sometimes you might wake up feeling like you're suffocating, and it's not just a feeling. You really will have low oxygen levels in your blood. This affects your blood pressure levels and can even cause high blood pressure. Look, isn't that interesting? You can get treatment and do everything you're supposed to, but if you have this condition I just explained, your treatment will be much harder, and often it won't work unless you address the root cause. Now, moving on to mistake number 7, not knowing the cause. Do you know the cause? Why do you have high blood pressure? Or why does your blood pressure sometimes go up? Do you have an answer for that? This is crucial because there are many conditions that will only get better if you find out the cause and treat it directly, like in the case of thyroid problems. People who have an excess of thyroid hormones, called hyperthyroidism, can get treatment, but if you have too much thyroid hormone, it's going to be very difficult. As an endocrinologist, I often see patients with elevated thyroid hormones, hyperthyroidism with high levels, systolic blood pressure reaching 180 to even 200 milligrams per deciliter. Look, this is really dangerous. And the treatment here, besides medication, to help with this, you need to treat this hormonal disorder. So you have to get evaluated. If you don't know, at your next appointment, ask your doctor directly, why is this happening? That way, you'll have a clue and be able to get more targeted treatment. To have more targeted measures. Or maybe you're eating certain foods that contain sodium or some substances like I explained before too. So you need to know the cause. And like I mentioned with hyperthyroidism, this can also happen with hypothyroidism. Why? Low levels of thyroid hormones affect the relaxation of blood vessels. This can also cause high blood pressure. But as for treatment, if your levels are stable, this shouldn't happen, okay? So you can't blame your thyroid if you're getting treatment and your numbers are good. Just like I said, you need to know the cause when you treat the cause, like with the thyroid too. That should be better. There are other disorders that can also cause high blood pressure, like having too much cortisol. As a rule, too much cortisol will cause other signs and symptoms in the body, not just high blood pressure, but it can also raise your blood sugar levels. Stretch marks, purple stretch marks, especially those wider than 1 centimeter, central obesity, more fat around the belly, and also the presence of a hump. That also needs to be evaluative. It's rarer than thyroid problems, but it does happen, and a lot of people would benefit if they found out this was the cause and got the right treatment. Mistake number 8 is about measuring blood pressure. A lot of people measure their blood pressure the wrong way. Want me to tell you how to fix that? I'll explain the right technique in a bit, but first I want to point out the two extremes. Some people check their blood pressure way too often. This creates anxiety several times a day, several times in the morning. Sometimes I check the log and there are 10 readings just in the morning. And then there are people who don't monitor it at all. So, what would be ideal? When there's a change in your treatment or when you're being evaluated to see if you need treatment, ideally you should monitor it every day. I suggest taking 3 readings a day, one in the morning, one at noon, and one at night at different times. But as I'm adding or stopping a medication, I like to monitor it more closely. Keep a closer eye on it. Once your blood pressure is stable, once a week or 3 times a week is fine. It really depends on the case. We have to be careful with this. There are people who never monitor it and people who monitor it way too much. You have to watch out for that number because it can cause anxiety. You end up with the blood pressure monitor by your side all the time, and the increase in cortisol, you saw that it can cause high blood pressure and also adrenaline. You get anxious, your blood vessels constrict, so you need to have the right number for this. It's also important to write down these numbers. A lot of times you do monitor it, but you don't record it. When you get to your doctor's appointment, the doctor can't calculate the average from the data to know how well it's being controlled. This is often one of the biggest mistakes. A lot of people make this mistake. And I ask, so how's your blood pressure? Oh, it's good, or it's kind of high, but how high? Sometimes it's this, sometimes it's that. But it's important for the doctor to be able to see this and calculate the average to know how it is most days, not just on one day or another here and there. So write down the date, the value, the time, and also your heart rate, another important detail. Another piece of information that the blood pressure monitor provides. This is also important in many cases because some blood pressure medications can affect your heart rate. And the doctor needs to have this information too. It's a very important additional detail. And mistake number 9 that people with high blood pressure make in the morning is about drinking coffee. Did you know that coffee can actually help protect against several diseases, including heart disease? But when consumed in excess, it can become a risk factor, even leading to heart arrhythmias. So what is that amount? What would be considered too much? The beneficial amount of coffee per day would be about 3 to 4 cups. 3 cups of 200 milliliters each, or 3 shots of espresso. But studies show that drinking 8 or more servings could increase the risk of arrhythmias. And a lot of people are sensitive to it. So with caffeine, you need to monitor your own response to see what happens in your case. But overdoing it with coffee is also one of those mistakes. You have to be careful. Just because it's a natural substance and has benefits, the dose is key here. Alright, everything in moderation. I really like coffee, but you also need to be aware of the effects of having too much. From 0 to 10, what score would you give this one here? If it's a 10, I'll make more videos, like this one. Also, right here which city you're watching this video from. I'm speaking from Porto Alegre.